Hi, everybody. This is the Dr. Debunk weekly podcast show. On this show, I'm going to be debunking the medical myths, garbage, and crap that's spread by doctors and other health professionals. Dr. Debunk is the medical truth teller. Today's podcast, everybody, is going to be on vitamin C, a long, hotly debated concept and subject. It goes back to 1960s. This is part of an ongoing series. I did vitamin D, about a month ago. And I'm going to slowly do all the vitamins and all the minerals. These are called essential nutrients. Because there's been so much controversy over the years, over the decades, really. Most vitamin and mineral work goes back about 100 years. That's when we first realized that the body needed these essential nutrients from our food chain because we can't make them. Like vitamin C, not all mammals need it. Vitamin C is essential. That means if you don't have any in your diet, you'll be dead in 4 months. You'll die from scurvy, which is pretty nasty. Nobody does anymore in America because it's all over the place and in plants and things. Anyway, but from my perspective and for all of you, it's about what are optimal intake levels of vitamin C. Because unfortunately, the original work was driven by minimal amounts. Most of you have heard of the recommended daily allowance, but I'm an old buzzard, so I go back to the minimum daily requirements. They really had what was the minimum necessary to prevent disease for 50 years, and then, about 20 years ago, they changed over to essential. And honestly, not essential, recommended. The recommended amounts are kind of a joke because they just kind of doubled the minimum and said, oh, this is the recommended, as though recommended was optimal. It's not. And so vitamin C and I have palled around a long time, probably 25 of the 33 years I've been a doctor. So I have my opinions about it, and that's what I'm going to share with you today. And so today will really be kind of a rational, practical way to do vitamin C replacement. Because the older you get, the more important replacing all essential nutrients and other optional nutrients become important. They're part of this whole process of optimal health living. And so vitamin C is known as ascorbic acid. It's one of the water-soluble vitamins. Basically, the B vitamins and C are the main water-soluble vitamins. For trivia stuff, it was discovered around 1910 or something like that. Anyway, and it's been studied essentially since then. It got famous in the 60s from Linus Pauling, which we'll get to in a minute. But, and as I kind of mentioned, it's significant because vitamin C is essential. That means we can't make it. So mammals like dogs, well, they make vitamin C. They make the B vitamins too. That's why dogs don't have to eat plants, because they can make water-soluble vitamins. And so vitamin C is, it's really a coenzyme. All vitamins are called coenzymes. That doesn't really matter. Any details on that? The deficiency issues with vitamin C are difficult because, as I said, we started out looking at all essential minerals and vitamins as being either normal or deficient to where you would have symptoms of disease, in this case, scurvy. And it's not really relevant because, scurvy is probably going to make a comeback in the United States because the dietary habits of young people today are so extreme. We might see it. The problem with vitamin C is when you're deficient, not to the point of disease, that's extreme deficiency, but we talk about deficiencies being minimal, mild, moderate, severe, or extreme, and extreme is disease. Nobody has really quantified the other 4 states of deficiency. And it's very difficult with vitamin C because deficiency all the way to disease. So if you have scurvy, you do things like you bleed from your gums are all spongy and yucky, you get brown spots all over your skin, I mean, you look pale, you're depressed, your tissues get spongy. Vitamin C, we'll get to it in a minute. The functions of vitamin C, they have to do with something called collagen, which is like a main protein. And vitamin C is essential to make collagen, which we use kind of all over our body. And so you're basically, I don't know, turning into a sponge if you don't have vitamin C. All your organs, your skin, everything. And so a person deficient in vitamin C, when it gets to severe extreme, is like a weak and sickly person. Well, Americans are getting weak and sickly. I mean, our society is getting weak and sickly. I mean, younger and younger people. I have patients that are 30 to 35 years old, and if you just saw them from across the street, you'd think they were 50. It's getting that bad. So my point is, deficiency statuses of vitamin C are difficult to pin down because, as I've said many times, you can't use a blood test to diagnose the deficiency of anything. Hormones, vitamins, minerals, nutrients, because it doesn't correlate until you're extremely deficient. And who wants to have the beginning stages of scurvy before you realize, oh, I need to get vitamin C in my diet? So anyway, and complicating that more, an minimal, infinitesimal amount of vitamin C, like 10 milligrams a day, is all that's needed to stop extreme deficiency. But optimal levels intake could be anywhere from 1,000 milligrams or more a day. And we'll get to that, how to take it. Anyway, but vitamin C has other roles other than just collagen and scurvy. It's been used extensively to treat common colds and flus and cancer. And before I get to that, we know that it has a role in heart disease, in forming or reducing the risk of heart disease. And so there's studies done that show that you'll have lesser risk of heart attack, strokes, other heart, blood vessel-related conditions, which really, we don't need any scientific studies to know that because it has to do with collagen. It's a tissue rebuilder. Well, our blood vessels and heart have to rebuild themselves, so of course it's intimately integrated into that. And now we know that vitamin D is a part of that. So anyway, but the two big uses or functions we'll talk about a little bit here now is cancer and colds and flu. So this scientist named Linus Pauling, he won a Nobel Prize in, I forget, genetics or something, back in the, I don't know, it was late 60s. Anyway, but he became obsessed with vitamin C and studied it extensively and wrote some books and papers talking about vitamin C could cure cancer and the common cold. And since then, it's been studied extensively. There's a lot of studies. And so the bottom line, as far as I'm concerned with cold and flu, vitamin C doesn't prevent it because it's much more complex than that. But vitamin C does seem to reduce the duration of your cold or flu if you take high doses. But we really don't know, and this is from the studies, because I've reviewed a lot of studies, we really don't know who it is. Is it young people, medium people, old people? Who benefits from taking a lot of vitamin C if you get sick? And how should you take it? And what are the blood levels that have to be achieved? And blah, blah, blah. I mean, there's a lot there. It's controversial. At one extreme, you have nutritionists and doctors that say it's worthless. None of those things work. The other extreme, you have, and I guess I'm more closer to this extreme, where people can get chelation therapy, IV vitamin C. You put it in your veins, high dose, and that can cure a cold, which, I do that. I do IV vitamin C with patients. It's something new we're beginning to do, but we'll talk about that in a second. But I think it's better in this regard to take high dose or to take an optimal dose, which we'll talk about in a minute. And whether you can load up when you have a cold and make it do anything, I don't know if I really think that's going to do work. I mean, I have patients over the years, for 33 years, tell me how magical it is, but I don't believe in magic. So anyway, cancer. Now, this is very interesting because, since Linus Pauling made his claims, it's been studied. The medical studies suggest there might be an impact against cancer with high-dose vitamin C. Now, there's two ways you can take vitamin C or any nutrient. You can take it through your mouth, or you can do it IV. And you can do sublingual. I mean, you can deliver nutrients at a higher level than orally if you do like oral absorption, sublingual. There's skin preps. You can deliver certain things through your skin. But the question has always been, can you take enough oral vitamin C to affect cancer? And the answer is no. I mean, you just can't. There's no way. I think it's absolute. But the question that remains that I am starting to do now and believe in is that IV vitamin C can be given in high enough doses to kill cancer cells. Now, there's enough science to know that IV vitamin C can kill cancer cells. Does. I shouldn't say can. It does. But can you get enough in your blood and deliver it to the cancer to cure somebody from cancer with vitamin C? And that's what remains unknown. There are at least 5 good case studies. And what these are cases that have been reported in the medical database about how somebody was told they have terminal cancer from liver cancer or breast cancer. There's 4 or 5 that I've downloaded and reviewed. And they are good and adequate reports about how a doctor gave nothing but IV vitamin C 2 to 3 days a week, high-dose therapy, and the person's cancer went in remission, and they were alive 5 years later, 9 years later, 10 years later. So these case reports exist. Are there any controlled studies? Not that I can really see. But it's hard to ignore these case studies. So I'm just starting with patients that want to do it, giving them chelation therapy with high-dose vitamin C to augment their treatment, or if there are people that refuse to get any kind of chemotherapy or medical treatment with cancer and they want to do natural stuff, I will treat them. It's their choice. And so that's a whole other thing. I really can't get into that because that's a specific medical treatment. But I don't believe the standard medical dogma that says there's no benefit from IV vitamin C. I think it's obvious there is, but we just don't know who, what cancer, exactly how to do it is beneficial. Now, apparently, naturopathic type doctors, the natural doctors, have been doing this extensively for a long time. I'm really not privy to their work, but there was a medical study done where they, or somebody, I don't remember, they did a huge questionnaire, and apparently by this questionnaire to naturopaths, they have been giving IV vitamin C a long time to patients for this. So it's kind of outside the scope of medicine, but anyway, a long little diatribe about that. But hopefully in the future, enough medical providers will do this and we'll get some controlled studies doing IV vitamin C to see if it really can help. I think it's an adjunct. I have a patient right now that's doing both chemo and IV vitamin C, and we'll see what the outcome is. Because the oncologist already said that this cancer is terminal, but this could give a longer life of a year or so. We'll see. Anyway, side effects of vitamin C therapy are really minimal. It's very well tolerated. I'm going to get to how to use it in a minute, because the main gist of this podcast is to give you a rational way on how to take it. And people can take a lot. But side effects, I mean, if you take too much, the biggest thing is diarrhea, but you can get abdominal cramps, Whether or not it causes kidney stones is a debatable issue. I don't think so. Some studies have shown an increase in kidney stones, but there's really, the rule seems to be that you can't take enough vitamin C to overdose because it's a water-soluble vitamin, and you'll just get diarrhea, and then you're just going to poop it all out. And that's why you can't take it orally for cancer treatment or high-dose therapy, because you can't get your blood level high enough because you'll just put it all in the toilet. Anyway, so that's kind of an intro. We're going to take a little break, and then when we come back, I will talk to you about how I believe is the best way to supplement with vitamin C. Hi everybody, Dr. Debunk here, and I bet you think this is going to be a commercial about KSK Cold Spray. But you're wrong, because if you've been listening to my podcast, then you know I've been pushing my spray. But the flu season's over, and so I wanted to mention to you something that some of you know I do, but that is about weight loss and weight maintenance, or controlling your weight, the whole subject of weight. I've mentioned it in some of my podcasts, giving little bits of information, but I have been studying weight and helping my patients lose and then maintain weight for 11 years. And this program I've developed with much trial and suffering is now capable of getting 30 to 50 pounds off just about anybody in 3 to 4 months. You heard it right, 30 to 50 pounds, 3 or 4 months. And so what you should do is, just to get some information, so what you should do is go to Dr. Debunk website, that's drdebunk.com. Welcome back. I've been talking about vitamin C, if you jumped into the middle of this, but hard to do, I guess. Anyway, so I gave you some background. What I want to talk to you now is about taking it. And so the underlying principle for supplementing, some of the basics, which I talk about in other lectures, for supplementing with hormones, precursors, nutrients, vitamins, and minerals, the 5 classes of things we can take to augment our health, to be more optimally healthy at all decades of life. Well, the first principle for a long time with supplementing has been that, under 50, it's not that valuable. I mean, I think there's plenty of evidence to show that, but that's changing now. It's changing now because of what I mentioned earlier, and that is alluding to that Americans are getting weak and sickly. I mean, in my 33 years as a doctor, I just see each younger generation getting weaker and sicklier in just every possible way. And their diets, young people's diets today under 30, can be atrocious. I mean, I cannot believe what I hear young people tell me they eat. And the food chain in America has become radically more polluted. It's just foods that have nothing but sugar, fat, salt. I mean, that's all they are. I mean, fast food. It's just so junky now. I mean, I have patients that eat it 3 times a day, and I'm like, they're not dead, because I'd be dead if I did that. Because when we're young, for so many reasons, we are so tough. And the other big reason I alluded to earlier is that the minimal daily amount of nutrients we need is so low that people can just chunk along. I mean, this is how in third world countries, how do people in third world countries survive? Think about it. I mean, they have almost no food. It's really weak food. It's limited. And yet they are born and grow and live and survive and can live long lives. And so there's a big difference between minimal and optimal. And medicine's never really cared about any of this. Nutrition and vitamins and minerals has never been an issue with doctors. I mean, we supplement in the hospital setting for various reasons. But, the concept is really, if you're deficient enough to be diseased, then we'll give you some. Otherwise, we don't really care. And so the principle that's really important here is, well, it's one movie to mess around about deficiency levels that are super low, and it's a whole nother movie to talk about, well, what do we need to be optimally healthy? And if you're very good with your diet, if you're educated and know how to eat, you can get plenty of vitamin C in your diet. But that's difficult, even for knowledgeable people. I don't get enough vitamin C in my diet. I mean, I know what to do. The problem is doing it. And so the older we get then, the more important supplementing can become. And so for a long time, I've seen that people start to really change around 50, but now it's down to 40 to 45. I mean, younger people today that at 42 years old are coming in my office telling me things that I didn't hear until they were 52 or 62. And so it's really difficult to say how much young people should supplement. But I think the way things have gone now, that even if it was 4 times a year, every quarter, everybody could supplement in a specific way, which we're going to talk about, with vitamin C. Because that's been the dilemma, the biggest question, and you'll get 20 different opinions on, well, how do you supplement with something like vitamin C? How many times a day, a week, a month? I mean, what do we do? And so I've looked at all of that. And my issue has always been around scientific principles, that if I can't justify it with known scientific principles, then it's all folklore, or it's my own bias for that matter. But the work in the last 10 years on vitamin D especially, but magnesium and other therapies, I think have really given us some more objective evidence about how to supplement with all nutrients. And so what it is it's what I call burst dose therapies. And burst dose therapies are where you take a lot of the nutrient that you want to supplement with over a short period of time, and then you don't take it again for a certain amount of time, weeks or months or quarterly. Now, in order to do it this way, you have to have data on things which we are really pharmacological techniques or principles. And what I mean by that is you have to know the peak plasma level of vitamin C. You have to know the terminal half-life of vitamin C. You have to know the rate of excretion by the kidneys or metabolism by the liver. There are these parameters that determine how long and how much of something you have to put in the blood, because how fast we get rid of it, how does it go in our cells. And so what's starting in medicine is to quantify that. Vitamin D has really changed doctors that have eyeballs and ears, have changed our reality in that our patients can do better, and you can treat medical conditions with things like vitamin D and get outcomes. I mean, it's longer than drug therapies, but anyway, vitamin D, I think, has been a game changer because vitamin D now is the most well-studied vitamin in the history of medicine, not in the history of nutrition or the other allied health fields, but for doctors, it is. And for those of us that have been paying attention, which is mostly primary care, it's a game changer. And so how does it work with vitamin C? Because there's a ton of work on vitamin C. We know all these parameters. We know how long it stays in your blood and how it gets in your body and blah, blah, blah. So here's the bottom line. People like to take 500 to 1,000 milligrams of vitamin C a day. It's a very common dosing protocol, and they take it forever. And you could do that if you're taking 1,000 milligrams a day, but there will be problems with that with age. Because with age, we don't absorb as well, and all these factors slow down the efficiency of whatever you're doing. Anyway, here's the big problem with vitamin C doing a once-a-day dose. It's not very effective because the half-life of vitamin C is a half an hour. Now, what does that mean? The half-life of anything is how long does it take for half of the substance to go out of your bloodstream? Because if you put a lot of vitamin C in your blood, your kidneys start peeing it out right away. Anything above the normal circulatory levels, optimal levels. And so the problem is with a half-hour half-life, 30-minute half-life, that means after 4 half-hour cycles, by the 5th one, it's almost gone. So that means if you take a vitamin C, no matter how much you take, in about 2.5 hours, it's completely out of your bloodstream. And so vitamin C isn't something you should take once a day. If you really want to get maximum blood levels, which you want, I'm not going to explain why, but it is not up for debate that high-dose blood levels are the most important and efficient way to resupply the cells of your body. We need to get really high blood levels to get the substances downstream where it needs to go. And so that means in vitamin C should actually be taken every half an hour for a certain amount of time. How long, you ask? I'm going to tell you. You should take 500 milligrams to 1,000 milligrams every half hour for 4 to 8 hours a day. Now, and the main reason is what I just told you, the half-life. By doing this, you can keep, even if you do it 4 hours, for 4 hours, you can keep a pretty high blood level of vitamin C, which is driving it downstream to the cells of your body that need it the most. Delivering nutrients to our cells of our body is a whole nother topic. But we have 40 trillion cells, and we have 100 billion supermarkets to deliver the food to the cells, 100 billion with a B. That means you put a lot of vitamin C in your bloodstream, it starts being sucked off by the first supermarkets. The vitamin C trucks are driving down the bloodstream, and they're dumping off vitamin C, literally dumping it off 100 billion times. So how much is left at the end of all this? Not much. So the last 2 to 3% of the cells of your body don't get a lot unless you put more trucks in the circulatory highway. That's why you redose every half hour. And to make it even more efficient, you should do sublingual vitamin C. That means the chewable vitamin Cs. So you chew it up, swish it around your mouth for 30 seconds. It goes right into your bloodstream, most of it, and then you swallow your spit, and the rest of it will be absorbed by your esophagus, and we bypass the stomach, which is a good thing. But a little bit gets down in your stomach and intestines, and you'll get that later. But this way, by redosing every half an hour, you keep the blood level high. And so if you did 1,000 milligrams, they make 500 milligrams sublingual chewables. You chew them up. If you do 2, you could probably do it for 4 hours. And that would be about the most. 7,000 to 8,000 milligrams a day is about the most you should take. I mean, people can take more, but diarrhea starts at around 10,000 milligrams or less. Some people can't do 7,000. So, but 500 milligrams every half hour for 4 to 8 hours is probably a good thing to do as far as efficiency, that everybody would probably be fine. And some of you are vitamin C nuts and you think it's going to magic cure everything. And I'm not saying that's bad, because there is truth to it. But and so how often then should you do this? That's up for debate. I think depending on so many factors of your life and your diet, naturally. So at a minimum, probably once a quarter. I mean, literally, if every 3 months you did this, you could probably maintain optimal levels. But then somebody else would have to do it every month. Some people will do it every week. And I might, with age, do it every week. I mean, we need to do a lot more studies on this, but since there's no money in it, nobody wants to do it. But it's so safe that even if you did this every week, you picked every Monday, 500 milligrams every half hour for 4 to 8 hours, you're never going to get too much. But there is no question about some of the principles of this, that it's absolute. At this point, based on the knowledge of the last 100 years of nutrient therapies, we seem to get better outcomes with high-dose therapies, short period of time, get a lot in your bloodstream, and then you don't take it, not every day. That's where problems come in. Now, it's not been shown that you can overdose on vitamin C. You could take 10,000 milligrams every day, and you're just going to diarrhea it out. I mean, you'd have a raw rear end, but other than that, you're not going to get your blood level any higher, and you're just throwing it in a toilet. So, but see, each nutrient is different, and that's the difficulty here. So vitamin D, we don't do it this way at all. You can take vitamin D like 1 day a week, 1 dose, because it's a fat-soluble vitamin, which means it absorbs more efficiently in our intestinal tract, so you can just swallow it. But it also has a long half-life. It's, I forget now, 24 hours. I mean, you can take it once a day, and it's fine. And so doctors give these 50,000 IU doses once a week. I don't agree with that one. I think 30,000 2 days a week. But I have a vitamin D podcast. You should look at that. It explains a lot of this with some different twists. And so minerals are even more complex because some minerals have half-lives of a week, 1 week. These things sit around in your blood. And so anyway, what I will do is slowly do all of them. I'm going to do all vitamins and all minerals because there's enough work done over the last 100 years to develop a rational approach to each one of these based on burst dose therapies for those of you that want to supplement. And the practicality is the difficult. I mean, about 5 years ago, I made this vitamin chart for my patients, but it was just too hard to do. And now with this type of an approach, I mean, if you only have to do vitamin C once every quarter, and then you can do other things, the B vitamins every quarter, and then the fat-soluble vitamins once a month or less, this would be a possible way to efficiently supplement with nutrients, vitamins, minerals, precursors, hormones. I mean, the hormone thing we have down, that's another lecture. So it's really an exciting time because I think over the next, it's going to take me at least a year, but I will have most essential nutrients, vitamins and minerals, laid out on podcasts, and then they'll be on Dr. Debunk 2 written so that you can see, okay, what's the minimum amount I should do if I'm 50 years old, 60s, 70s, each decade of life will be a little different. And then it'll also be compensatory with what's your diet like. I mean, the farther you are from a meat-eating rabbit diet, because we should be kind of meat-eating rabbits, either pure vegetarianism or meat-eating vegetarians. I guess that's an oxymoron, but a little bit of meat isn't bad. Anyway, all of that will be a big role and factor, along with many others, of how much you should supplement. So that's pretty much it. A little review is that vitamin C is very safe to take, supplementing. It's pretty much impossible to overdose, but people that take a lot are just putting it in the toilet. I believe in the burst dose therapy principles, that you take it a certain amount every week, every month, every quarter. And in this case, the amount is 500 milligrams to 1,000 milligrams every half an hour for 4 to 8 hours a day. And you do it 1 day a week at the most, all the way down to once every quarter, which is what I try to do, about every 3 months, 4 months at the most, I'll do this. And you just basically chew on the vitamin C sublinguals. You just munch them up in your mouth and swish them around. And then a half hour later, you do it again, and you just set your phone alarm to go off every half an hour, whatever practical way. But I believe you'll be healthier by doing this. I'm Dr. Debunk, debunking medical myths, garbage, and crap spread by doctors and other health professionals. And I'm the medical truth teller. Thanks for listening.